You're listening to Clinical Connections, the Zepf Center podcast connecting you to the latest clinical topics. Welcome back, and thanks for joining us today. In honor of Minority Health Month, we're taking a closer look at physical health and why it plays such a vital role in our overall well-being. Joining us for this conversation is Health Center Executive Director Diamond Williams. Since joining the team earlier this year, Diamond has focused on breaking down barriers to care, delivering innovative services, and empowering clients to take control of their health journey. In this episode, we'll explore Zepf Center's primary care services and the impact of accessible, trauma-informed healthcare within behavioral health. We'll also talk about the importance of integrated care and discuss its impact on improved outcomes for individuals and families across our community. Let's get into it. Well, welcome to the studio. Would you like to introduce yourself to our listeners?
Yeah, thank you for having me here, Juan. My name is Diamond Williams, and I am the Health Center Executive Director here at Zepf. My main goal is to really make sure that our patients have access to good quality care.
Great. Well, let's talk a little bit about what primary care really means and what services we offer here.
Yeah, so primary care is really that foundation that everyone needs one. But primary care is where you go for all of your healthcare needs. It's the first stop. So if you have any other problems, you're going to address that with your primary care provider, and they're going to get you to where you need to go. But your primary care provider is someone that you should be meeting with multiple times throughout the year, in addition to your other specialty providers.
How does primary care fit into our overall mission of hope and recovery?
So primary care fits into our overall mission because you really can't focus on healing or recovery if your physical health is off. You can, but when you feel better overall, that will help you have a more successful recovery journey, healing journey. And again, you really want to be able to have a good foundation. So when you have that good foundation and you know what your other physical health problems are, it will help you be more intentional about your goals in your recovery and healing journey.
Sure. Sounds like really good whole person care.
Yes.
What are some of the common physical health concerns that you're seeing right now in our community?
So a lot of the common physical health concerns that we're seeing right now is uncontrolled diabetes and hypertension. Hypertension is really a silent killer. You know, you may feel perfectly fine one day, and then the next day you may be in the hospital with stroke-like symptoms because you have uncontrolled hypertension. And hypertension is really something that's easily managed with diet, exercise, and if you need medications as well. And same with diabetes. You know, people oftentimes wait until there's something wrong to get care, when really we have all of the things that you can be proactive and really take care of those preventative aspects of your health.
I know that there's plenty of people who haven't seen a doctor in years. Why would it be important to start now?
So I say this all the time. It goes back to prevention and self-care. We have all of these things that we like to do for self-care, like getting our nails done or massages and all these things, but there's lots of people in this world who's like, I haven't seen my primary care doctor in ages, or I don't even have a primary care doctor. And they tend to feel like if there's nothing wrong, then I don't need to see them. But sometimes that's good. Like, you still need to establish that relationship with your primary care doctor and really just go for an overall wellness check. Like, check your overall wellness. Know your numbers, know your status, because when you know and you're being preventative, those things that could possibly happen may not be a shock because we've already prepared for those things.
In April, we observe Minority Health Month. What does this observance mean, and why does it matter for our clients in our community?
Yeah, so it's really about awareness, but also accountability. Making sure that everyone has fair access to quality care. We know a lot of people, and minority is such a broad term, a lot of people just struggle with access. And when you're aware of what's around you and when you're aware of the services that organizations provide, that is where you can tap into that access. But that also comes with other layers that we have to be intentional about, like building trust.
What are some of the biggest health disparities affecting minority communities today?
So some of the biggest health disparities really affecting minority communities today is higher rates of chronic illnesses and lower access to early prevention. Again, many people are waiting until they feel like there's something wrong. And typically that's a sign that it could be too late, or we're finding something at a later stage where we're not at that early prevention. So there is a huge lack of follow through on those preventative services, but it's something that we're actively working on. And I think it's something that we all have to be intentional about together as a community.
What barriers do people in these communities face when trying to access care?
So the main barriers that we see is transportation. A lot of folks just don't have access to transportation, or they're unaware of the services that is around them. Most of our Medicaid managed care plans have access to transportation, and many patients just don't know about that service. And we have other services in the community like Tarta Flex and the bus. Public transportation is something that's looked over all the time, and a lot of patients just don't know. They don't have anyone to teach them how to use the bus system appropriately, or they don't have anyone to help them schedule that appointment to be able to go to their primary care appointment, or they don't know that your insurance will also cover you going to a specialty appointment. It's not just primary care, all those extra perks. And transportation is the number one barrier that we see.
You mentioned trust as well, that can sometimes be a barrier to treatment. How can healthcare providers do a better job building trust in our underserved communities?
Yeah, trust is huge. It goes back generations and generations of systemic oppression and lots of other things that we can go. That can be a whole nother podcast, really. But really, providers just need to do a better job at taking their time and listening to our patients. Most of the time, people just want to be heard. And it's something that, when you may have several other patients, or, you have all these things that you want to address, it can be easily overlooked, but people just want to be heard. They just want someone who's going to take the time to truly listen to their concerns and hear them, and really work alongside them to get to their goals, and not feel like, since you're the doctor, this is my way. And many people in the minority community, they have white coat syndrome. So they're truly afraid to go to the doctors, or they know of horror stories from other people in their families. And again, I say this goes back generationally. If they didn't see their mom and dad take care of their health, or their grandparents take care of their health, they're not going to feel like that's something that's normalized. So when they finally do get in the doors to see a provider, it's so essential to make sure you're taking the time to really listen to that patient, bring them back as often as needed to develop that relationship before, it's just we're throwing all these meds at you, and it can be overwhelming. So really just taking the time to sit down and listen and hear them.
What steps is our organization taking to make care more accessible and equitable?
Yeah, so one thing that we're doing in primary care is patients can walk in. Sometimes it's not I really need to schedule this appointment. It's like, I have the day off today. Let me call and see if I can get in. So we are accepting walk-ins. We are open 8:30 to 4:30. And if a patient walks in and they say, I've really been having this issue with my ear, we're going to see you. And I think it's super important because when we talk about access, patients need to know that we're accessible and they can come in and get the care that they need. And it doesn't necessarily need to be super formal. And yes, of course, we encourage people to schedule appointments, but if their kid had a 2-hour delay and they had some time off in the morning and they want to bring their kid in for something, do it. We're going to make that time. And that's one of the many things that we're doing right now. I would also say we're really having a strong focus on that preventative care. It's something that can be challenging, but we are really working together with our teams to encourage preventative care as a whole. And if we can be on top of patients' health, then we can help improve all the other aspects of their life as well.
That's great. And Zepf Center is based on a continuum of care. From your perspective, what does that look like in action?
Yeah, so that really means we're not just treating one thing. We're supporting the whole person across every stage that they're in life, and really giving them the tools to be successful.
How does primary care work alongside mental health and substance use disorder treatment?
So we work side by side so our patients don't feel like they're being passed around. Like, we're going to just send you here. We're going to just send you there. It's really that collaboration. We can all see each other's notes, which is great, because if you're seeing your primary care doctor and you just met with one of your mental health providers, and it's something that they noticed that they wanted to follow up on, they can say, hey, like I see that you saw Jennifer last week and I really just wanted to circle back on something. It really just shows patients that we're truly integrated and we're working together to make sure that, again, they're meeting their healthcare needs and goals.
Why is that integrated care so important for long-term health and recovery?
It's really important because, life isn't really separated into boxes. Life is life and life sometime. And your physical and your mental health really impacts each other. You can have something that's going on with your physical health that truly is impacting your mental health, or vice versa. And it's very important that we are addressing both of those things at the same time.
I think that's such a key point, and I'm wondering if you can share an example with our listeners of how integrated care has helped one of our clients.
Yeah. Man, I have so many stories. So I'm going to kind of take it off a separate end, and we're going to focus on something, or I'm going to talk about dental care, because oral health is not often thought about as health. And I know it's not one of the services that we offer here, but it is something that we talk to our patients about because, again, just like mental health, oral health is health. It is all of your health. And this patient came in and they were super irritable. They were having trouble sleeping, and one may not think to say, well, do you have any problems with your teeth, or do you have any new infections in your mouth? Because they kept holding their jaw and they're like, I'm just so irritated. And they're like, actually, I do. Like, I have some pain in my back molar. And we're like, oh, well, when was the last time you seen a dentist? And they're like, it's been years. Like, I'm not even really thinking about it or worrying about it. And honestly, that was the root cause of their irritability. They had some pain in their mouth. They had a long-term dental infection that wasn't addressed, and it was causing them to be irritable. It was causing discomfort, and we were able to get that patient in to see a dentist immediately. They were able to get an extraction, and they came back feeling so grateful because they're like, I honestly didn't think it had anything to do with my oral health. Like, I didn't even think about the tooth. Like, I just thought, it's been bothering me. It's whatever, but it has to be something else. But they were feeling so much better, and they were very thankful that we were, one, even thinking about their oral health, and then two, accessible, that we were here, we were able to work with them, and we weren't dismissive of what their true problems were.
And I think one of the things people might not realize is that these services are available for the whole family. Can you talk to us a little bit about what types of services are available for children, adults, as well as the whole family unit?
Yeah, so all of our providers are credentialed to see the whole family, so 0 and up, and we do all of the well child visits, and we partner with our health department to be able to get those vaccines in arms, but we will see the whole family. And what's really important about that is that, we talked a little bit about things being generational. When you see your mom going to the doctor, or mom is going to the doctor at the same time that you're going to the doctor, that's going to be normalized for you. You're going to say, oh yeah, I do remember going to the doctor often with my mom, or we went at least once a year to get checked up on, they're going to know that that is something that's normal and it's something that's important to be taken care of. So yeah, we see all ages, and we'll do well child exams all the way up to teenagers, adolescents. We'll see it all.
How can families support each other in staying healthy?
So really, it's the little things, encouraging people to show up to their appointment. If you know that they've talked about it, even, sharing where they can go and get care, and normalizing the conversation, really cheerleading each other to make better choices. If you meet with your family and you hang out, like for an example, my family and I, we get together on a monthly basis, and we know holidays, we like to eat all the not healthy foods, right? All the pies and all the things. But we try not to do that on a monthly basis, and we try to be intentional about what we're bringing to our gatherings on a monthly basis, that it's healthy. And we're showing my nieces and my nephew, like, yeah, this is normal. We eat healthy together. Not every time we get together, we're going to be eating unhealthy. And that's just something very small. But even if you just say, hey, Mom, when was the last time you seen your doctor? And encouraging her to make that appointment, and just giving her that hope and that guidance to say, it's okay, and this is what you should do, and we need to stay on top of these things, because it's not a bad thing.
Absolutely. Why is it important to treat the whole family and not just the individual?
Because health habits, they don't happen alone. They don't happen in isolation, and families really influence each other more than what we think. And it goes back to, if my mom's mom never went to the doctor, she's probably not going to ever go to the doctor. She's probably not going to encourage her kids to go to the doctor. And it kind of just it's like a domino effect. And yeah, bad habits really they don't happen on their own. So when you address things and you do things as a whole, as a family, you implement healthy eating or exercising as a family, more times, for small children, it's going to continue in their adult life, because they're going to see that it's normalized, and that's maybe what we should be doing.
Yeah, like a culture of health and well-being.
Yeah, absolutely.
Well, certainly we're not the only ones that provide this service, but tell us a little bit about what makes your approach to care different from those other providers.
Yeah, that's a great question. I love that question. We focus on that whole person care, and we don't treat symptoms. We really want to make sure that our patients know that we're intentional about building relationships, and really focus on that whole person. You are in the center of your care, and we are right here alongside you.
How can our community take small steps today to improve their physical health?
So they can really start small. Rather that's going on a daily 30-minute walk, or if they are stationary at work, taking laps around their work or their office, doing some stretches. Very small. Get your body moving, drinking water, and call your insurance company and say, who's accepting new patients, or Google it, or talk to a friend or a family member. But really start small. I mean, I know sometimes that it can feel overwhelming when I haven't seen a doctor in years, and it can cause a little anxiety too. I don't know what they're going to tell me, or I don't know the state of my health. But if you take one step every day, getting closer to that end goal, you're going to get to where you need to be. And then there's no going back. You're going to have a partnership with someone who's really going to be there alongside your care. So just take small steps, even if it's just drinking water or going for a walk.
Diamond, you have had so much great information for us today, but I'm wondering, if there was one message that you want people to take away about their health this month, what would it be?
Don't wait until you feel like there's something wrong. Go to the doctor, stay on top of your preventative screenings, be intentional about your health care, and know that you have support. Especially here at Zepf Center, you are going to have that support from the moment that you enter our doors. And it's truly a team of people that care about you. So don't wait until you have that pain. Don't wait until you feel like there's something off, or you see something on TikTok and you self-diagnose. Truly be intentional about taking care of yourself, because when you take care of your health, that really is self-care as well.
Well, I'm hopeful that some of our listeners are going to be inspired by our conversation today. Where could they go to learn more or to schedule an appointment?
Yeah, so our listeners can go to our Zepf Center website and go to our primary care tab. That has all of our information to be able to schedule an appointment or just to learn more about what primary care is.
Diamond, thank you so much for your time today and all the information you shared with us.
Yes, thank you.
Thank you so much to Diamond for sharing her invaluable insights on physical health, integrated care, and why family-centered services are so important. If you're listening and you want to take the next step, remember that our primary care services are part of our full continuum of care, available to children, adults, and families. Whether you're focusing on prevention, managing a chronic condition, or connecting with mental health and substance use support, we're here to help you every step of the way. If you enjoyed this episode, be sure to download and share it. For the latest clinical connections, subscribe on Spotify, Apple Podcasts, or wherever your favorite podcasts are found. For more information about Zepf Center's primary care and other resources mentioned in this episode, check out our show notes. For more information on Zepf Center, visit us at zeffcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, this is Dr. Jennifer Jansen, signing off.